All right, Dr. Linda Rosenthal, gastrologist at MedStar Health, is in the studio with us today. Now, I know the prep for this because my husband just had a colonoscopy, but share the lovely prep with all of our viewers out there, doctor.
Well, first I want to say that a successful colonoscopy actually not only depends on the physician doing the procedure, but on the motivation of the patient. Remember, we need to see the lining of the bowel. We do not want to look at poop. So I would, our staff will instruct the patients in a limited diet, which could be a low residue diet, it could be a clear liquid diet for anywhere from 1 to 2 days, followed by a variety of different laxatives. As I tell my patients, they will not run to the store after they take their bottle of laxatives. They'll stay near the bathroom. They will have more bowel movements than they ever dreamed of. But again, you want your physician doing the colonoscopy to say, it was clean, there were no polyps, and it was clean. I didn't find any polyps because you did a great job with your clean out and prep.
So what actually happens during a colonoscopy?
So the patient is usually under anesthesia, and the physician takes a very long scope and goes all the way to where the opening of the appendix is. That is the top of the colon. And as the scope is withdrawn, the physician is looking behind folds, looking at the lining of the bowel. A good withdrawal time, which means we have some standards now as to, how are you going to find polyps, how many will you find, requires that the physician withdrawing the scope spends a lot of time looking around corners, putting air in, taking air out, maybe turning a patient, but looking for these growths in all the nooks and crannies that are your colon.
So it's safe to say that the prep is worse than the procedure.
Many times patients will say that to me, and if they have to have another colonoscopy, we'll offer them a different set of laxatives.
Look at the weight you'll lose. Talk to us, doctor, about open access colonoscopy.
So a lot of people just want to get that colonoscopy done. If you are a healthy adult, ages 45 to 70, chances are you can call our office or our endoscopy center and be hooked up with the date and time that would be easy for you. Open access means you didn't need to come to the office, get instructed by the staff in the office. It saves you that one trip.
So it kind of simplifies the process.
It really does. And most people who are healthy can be instructed over the phone. It takes anywhere from 10 to 20 minutes for our staff to do all the instructions as well as get a little medical history. Who are the patients who are good for open access? Patients who have no medical problems or who have stable medical problems. Again, our staff asks a variety of questions. That questionnaire is then reviewed by a physician. If there's something that doesn't look right, we will ask that patient to come in. But and if you're over 70, we ask you to come in. But most patients can just make that phone call and get their procedure done.
All right, doctor, thank you so much for coming in. You see our experts from the other studio right now. They are taking your calls until 6:30. Also, MedStar is offering free health kits to Maryland residents. So for details on how to register for one, just head to our website at WMER2news.com.